The new members of the Advisory Committee on Immunization Practices will continue their first meeting later today. The 7 newly appointed members of the panel discussed childhood vaccines yesterday. And joining us now ahead of day 2 is former FDA Commissioner Dr. Scott Gottlieb, who served in the first Trump administration. He's a board member with Pfizer and Illumina and a CNBC contributor. And Dr. Gottlieb, thanks for being here.
Thanks a lot.
So walk us through what this means. There was a lot of fanfare when Robert F. Kennedy Jr. fired basically the 17 people who had been on that vaccine panel before. There are 7 new members. What are we in for today?
Well, there was 8, but one dropped out because they didn't want to sell his stock, so he couldn't get through the conflicts check. Look, these are individuals who've been unabashed about their anti-vaccine views, for the most part, the members who've been appointed.
All of them?
So most of them. I mean, the ones who aren't, sort of considered anti-vaxxers, I think, have been skeptical, at least of the COVID vaccine. They deferred a lot of the decisions, the controversial decisions, from day 1 to day 2. So I think day 2 is when we're going to see some of those sentiments become manifest. And the 2 places they're focusing, I think, today is on the MMR vaccine, which is the measles, mumps, rubella, and varicella vaccine. So it's a combined chickenpox MMR vaccine, which has long been a bugaboo of the anti-vax movement because there's a small risk of seizures. That risk can be fully mitigated if parents check the temperature of children between day 5 and 14 and treat any fever above 100.5. There's sort of a delayed febrile reaction to that vaccine. Only about 10% of kids get it, but
10%.
But anti-vaxxers have wanted to bring this off the market. Mm-hmm. The other issue that's going to come up today is thiomersal, which is a preservative that used to be used in vaccines. It was largely taken out.
I didn't think it was there.
Right.
Anymore.
So this happened when I was at FDA in the early 2000s. We pulled thiomersal out of the vaccines and moved from multi-dose vials where the preservative was to single-dose vials that didn't need a preservative, largely not because we thought thiomersal was unsafe, but because there was so much speculation among the anti-vax movement that it was linked to autism. We felt we would never get out from under that cloud, so we reformulated those vaccines. But it's still in about 4% of vaccines that get delivered in flu vaccines, mostly for adults. Most children do not receive a vaccine from the multi-dose vial, but certain clinics still use that multi-dose vial, about 4% of the administered vaccines. They want to withdraw that from the market as well. The other issue that's going to come up, but I think it's been largely deferred to a subsequent meeting, is that there is a movement among the Secretary, Kennedy, and others in the anti-vax movement to take alum out of vaccines. So alum it's an aluminum salt. It's used in about 7 different pediatric vaccines, including one by Pfizer, as an adjuvant. So it helps stimulate an immune response. So they want to force manufacturers, I believe, to reformulate those vaccines. That would be a major issue because this is a very safe ingredient. It's been used for 70 years. There's really no alternative. And if they force manufacturers to have to reformulate all those pediatric vaccines, I think you'd see a lot of vaccines potentially come off the market because there is no good alternative.
Meaning that they would no longer be effective? They wouldn't stimulate the immune system?
There is no good. The other adjuvants that you could potentially use probably aren't as safe. But if you had to reformulate those vaccines, it would create a real dislocation in the market. That was supposed to be on the agenda for this meeting. They took it off. So I think they've deferred that discussion by and large. But I would expect it could come up today as well as a prelude to future meetings.
So the MMR and varicella, the idea of treating a fever, first of all, I'll say I didn't realize that 10% of kids get a seizure reaction or a fever reaction.
No, so 10% of kids get the MMR vaccine. So most kids who get vaccinated for measles, mumps, and rubella get the MMR vaccine and a separate varicella vaccine, largely because there is this small risk of febrile seizure associated with the combined vaccine. That risk, again, can be fully mitigated. Most parents wouldn't know to check temperature 5 to 14 days out.
Having 4 kids, I've never heard that.
It's a delayed febrile reaction. That's why some kids get in trouble because you get a fever day 10, it doesn't get recognized, doesn't get treated, and then you can get into trouble. So the people in Kennedy's orbit have wanted to pull this vaccine off the market. It is on the agenda today. So I think they're either going to vote.
If they pull it off the market, though, you would still be able to get those 2 vaccines separately.
You'd still have the alternative.
And varicella.
Yeah, I think, if you take a step back, look, if they pull the MMR vaccine, it's not going to have a dramatic impact on availability of vaccines. If they pull the multi-dose vial of the flu vaccine, like I said, it's only 4% of people who get that. But I think this is a prelude to them demonstrating their ability to go in with this committee now, make recommendations to pull some of these vaccines and force those decisions. And if they're able to do that here, it's setting up a decision around alum.
Okay, I would say the ones you told me about today don't concern me as much because you'd be able to get those shots separately. I mean,
right.
I guess
it's
if you've got
precedent.
a 5-year-old and you don't want to give them all the shots that you're supposed to be getting, you'd have to take 2 for the varicella without. What?
It's the precedent because it's the idea of ACIP unilaterally acting to do this. These are typically decisions that would have been left to regulators to determine the safety and effectiveness.
Yeah.
ACIP has the capacity to make recommendations about who should and shouldn't get these vaccines. But the fact that they're wading into these issues that have long been considered settled science, particularly thiomersal. And remember, back in the early 2000s, the bugaboo was that thiomersal was linked to autism. We took thiomersal out of the vaccines.
Everything for children.
Now they've moved to alum. So now the arguments are, well, it must be the aluminum hydroxide. So it just
So they're just going to keep chipping away at what's in the vaccines
right.
to say this is what causes autism.
That's what's been created over the last 10, 15 years, is you just move from one issue to the next.
Give
and
a
you
mouse
can
a
never get
cookie.
in front of this.
Yeah. I wonder what you think. I mean, there was Tyler Winklevoss had a post today on X, or maybe it was last night. It was related to. It was related to.
How do you follow your Bitcoin
What's
holders?
happening in New York City with the mayor, and it's a strange thing for me to see the connection between the two. But he basically says, "Look, you have all of these young voters who don't realize what happens." They don't remember the crime in the cities in the 1980s and, the squeegee guys and what happened before you had the crackdown on some of these things. So he thinks it's a bad idea for this mayor to get elected, but he says maybe it's what they need to see, a little bit of socialism, to see what the outcome is and what that might mean for safety on the streets. And I wonder if it's the same story with vaccines. People forget what it was like to have measles run rampant. People forget what it was like, even chickenpox, which you can survive. I mean, I had chickenpox as a kid.
It's a bad disease.
It's a bad disease. You don't want to see all of these childhood diseases that we have forgotten what they do.
Yeah, you certainly don't want to see that happen, that there is a backlash to this anti-vax movement because we've seen the consequences of it, because a lot of people are going to be harmed in the process.
Right.
But the problem is that these sort of sentiments have been fueled over a long period of time, certainly accelerated during COVID. The mandates, I think, fueled a lot of the anti-vaccine backlash.
And by the way, I remember you saying this during COVID, that you worried the way the administration was going about it at the time.
Well, I was against the mandates,
You were against the
mandate.
mandates.
For this reason, we said it on this show that it would fuel an anti-vaccine backlash, and I think that was a tipping point of sorts. But the problem is this is going to be a very long cycle. We've now built a lot of anti-vaccine sentiment. Secretary Kennedy is fueling that with what he's doing and groups like the ACIP that he's constituted. The consequences of this are going to be felt for years. They're going to grow over time. We've seen MMR vaccination rates sharply declining. More than 50% of states are well below herd immunity. There was just a survey put out. Some states are below 70%, so they're going to have potentially outbreaks. So you are setting up a lot of risk for the future. And I think
outbreaks for what?
Measles.
Measles.
That's the one we worry about the most because it's so contagious and vaccination rates are falling. You don't want to see a situation where we learn our lessons from what's happening right now in 5 years as a result of outbreaks where kids were harmed. I hope that's not the case.
The secretary himself, Secretary Kennedy, has said that the reason he is making these changes and wants to see them is that there is so many questions about vaccines. He wants to be, in his words, I think, or paraphrase his words, he wants to open things up and make sure that both sides are being explored. Do you think that's what's happening here?
Look, he's been a motivated anti-vaxxer. I think he's been unabashed about this. And one of his close advisors said when he gets the keys to the kingdom, and those are the words, he's not going to back away from his positions. He's been hardened in these views. I think he's setting up a litigation enterprise. I think that's what this is about. There's 2 members of the AdCom who both served as expert witnesses in litigation against Merck, didn't disclose that as a potential conflict. We know the secretary had an interest in ongoing litigation, the Gardasil vaccine that he gifted to his son. So there's a very vast litigation enterprise, and if you start pulling out ingredients like thiomersal and alum, and there's sort of an official sanction given to that, I think what he's setting up is to declare in his autism report in the fall that there's a link between alum and autism. I think that's where this is heading if I was to make a prediction. If he does that, that will open the door to litigation under the Vaccine Injury Compensation Program and create a whole wave of lawsuits that I think will drive a lot of vaccine makers out of the market You could see
So he
companies
won't even stop them from doing it. He will do it through the lawsuits, and that will make the companies say, forget it.
Well, he's always seen litigation as a tool to try to achieve his objectives. You could see companies, people say, can the companies get out of the manufacturing of vaccines? They can certainly spin it out. And at a time when every other nation is trying to build up its vaccine enterprise and sees it as a national security imperative, we're dismantling ours in this country.